So now I'd like to spend a little time talking about more of the details when it comes to adverse effect identification and management. So the common side effects that we tend to see with these stimulant products are things like loss of appetite, nausea, upset stomach. We can also see difficulty sleeping because it is a stimulating medication. Individuals can experience things like headache and basically like on off of symptoms. So when the medication starts to wear off, they can feel a rebound of their symptoms. More rare but serious things like psychosis or mania. We can sometimes see irritability, aggression, violence. So obviously if those types of things happen, that means we should probably remove the stimulant, try to assess, and very cautiously reintroduce if appropriate. There are instances where severe anxiety and panic can start to happen from a stimulant. Again, looking at that risk and benefit, got to be cautious with that. Some individuals will experience dysphoria, so kind of the opposite experience. They become dysphoric, they become numb, zombied, etc. Not have a good experience with it. We don't like to see tics or abnormal movements if those start to appear or worsen. Things like increasing pulse, increasing blood pressure, be cautious about. And then growth. So with individuals who start stimulants very young, there is weight loss and weight concern for sure. In a lot of cases, this can be managed pretty well with timing of meals, with monitoring, sometimes judicious use of drug holidays if appropriate for the individual. And things like the height deficiency tend to be fairly small. We'll talk about that in a little bit of detail. So when we're looking at these types of adverse effects, if they're having that loss of appetite or anorexia, we want to monitor weight and growth curves, especially for kiddos. So growth curves aren't as important for adults, obviously. And if they're having trouble eating while the stimulant's sort of doing its job, timing meals can be really helpful. So having a bigger breakfast and dinner can help to kind of compensate for a lower appetite for lunch, for example. If an individual is having difficulty sleeping at night, changing the formulation so it wears off sooner, reducing the dose, especially if they have an afternoon dose. And then sometimes we can add products. So things like clonidine, which can also treat some of the symptoms. Sometimes melatonin can help. If it's occasional insomnia, I do want to stress that. Occasional insomnia may be a diphenhydramine or Benadryl. Now, diphenhydramine should not be something that is used consistently. It has a lot of risks associated with it. So diphenhydramine, if judicious, very rarely used, sure. If they find irritability, we can reduce the dose, try a non-stimulant, or if it's really the only thing that's otherwise been really beneficial, sometimes we can add an antipsychotic medication, but those have their own risks associated with it. This probably more commonly occurs for individuals who have autism and ADHD, because some antipsychotics are particularly approved and beneficial for irritability associated with autism as well. That growth inhibition, so things like holidays, and what I mean by holidays is taking time off of stimulants in the summer, for example. Now, some children, that's not a reasonable expectation, and I absolutely don't recommend if someone is like going somewhere for Christmas or going on vacation where it's an environment that disrupts the child's day-to-day structure to also take away the stimulant. So don't do drug holidays on actual holiday. That's definitely something I do not recommend. So, because just that additional disruption with their structure, their day-to-day can be really difficult. Most children do catch up to their height growth inhibition. But we can expect maybe a 1 to 2 centimeter decrease in total height. Hypertension, so monitoring things like vitals at each visit and adjusting the product if hypertension occurs. And then just being cautious about things like drug interaction. So other stimulants can have a cumulative effect. Things that are CNS depressants can be particularly concerning. This is more common in our teens and adults, But the challenge with alcohol use in particular and stimulants is some of the effects of alcohol that would signal to someone that they're intoxicated are mitigated by stimulants. So an individual might actually drink more excessively and not realize that they have when they're taking a stimulant. So being really careful, their perceived their perceived intoxication, their perceived impairment can be less so if they have a stimulant on board. So bad things can happen. So be really careful with that. There are some pharmacokinetic interactions with other medications. That's something you want to talk to your friendly local pharmacist about. However, so from a safety and monitoring perspective, things to just check in on, right? So screening for medical history, specifically cardiac disease prior to initiation of a stimulant. Really, unless there is something really concerning, in most cases, we don't need to do like an electrocardiogram or anything like that. We don't recommend it unless there is a significant concern. And if they have suspected current cardiac disease, I would recommend consulting with a cardiology specialist there. But we do want to check blood pressure, heart rate, and weight, right? Growth curves for sure if they are still in their growing phase. And screening for substance use history is appropriate. At follow-up, blood pressure, heart rate, growth curves. Rare but serious, we do sometimes see priapism, which is a prolonged painful erection, and that can be potentially quite dangerous. So monitoring for the event of that happening. And then worsening or new onset peripheral vasculopathy like Raynaud's, changes in things like difficulty sleeping, agitation, irritability, anxiety, or that other side, right? That feeling kind of weird, zonky, zombie type feeling, okay? Now, usually when you first start it, we want to do really monthly follow-ups during the titration phase. Then once they're stable, semi-annually. So depending on the individual, your comfort level, how stable they are feeling, every 3 to 6 months. I usually don't recommend going less than every 6 months for follow-up visits for your med checks for these products.